Today, we will be talking about celiac disease. What is celiac disease? Celiac disease is an autoimmune disease, meaning that a person's immune system will attack healthy cells thinking they are bad. Celiac disease occurs when the body produces an allergic reaction when gluten is ingested and results in the malabsorption of nutrients, an inflamed lower intestine, and damage to the hair-like structures lining the small intestine called villi. Gluten is a protein found in wheat, rye, and barley. People who have celiac disease cannot eat common foods like pastas, breads, and crackers because they contain gluten in them. Many websites have lists of food and beverages laying out what has gluten and what does not. With Halloween just around the corner, websites provide extensive lists of candies that are gluten-free and those that are not, so parents can keep their children safe. How does celiac disease affect the body? Inside the body of someone affected with celiac disease, the immune system is programmed to see gluten as a threat. Ingestion of gluten signals an allergic reaction in which the immune system launches an attack on the small intestine in response to the threat. Attacks on the small intestine cause inflammation and are injurious to its villi, the small finger-like projections along its lining that ease nutrient absorption into the body as put by the Celiac Disease Foundation. The presence of villi increases the surface area relative to volume, assisting in transport. Repeated damage to the villi causes them to shrink in length, and so the surface area relative to volume decreases. The decrease in surface area makes transport increasingly difficult, and the villi are no longer able to perform their function of nutrient absorption effectively. Malabsorption leads to many of the symptoms discussed later on in this presentation. Also, according to the Mayo Clinic, once someone has been diagnosed with celiac disease and taken up a strict gluten-free diet, it could take several months to years to completely heal the damaged villi. Now we're going to look at pictures that are inside the body. Depicted in the image on the left is a close-up view of what happens when gluten is ingested. As stated at the beginning of this presentation, celiac disease is caused by an immune system response to ingested gluten proteins. In the picture, the gluten proteins have permeated the wall of the intestine, and the immune system response has been triggered in which antigens have been sent out to attack and rid the threat. The effect of the attacks on the villi are best shown in the picture on the right. Its shape is significantly altered to be shorter in length. Picture the nutrients that the body needs to absorb the passing over the villi. The normal healthy villi are able to reach the nutrients above and bring them into the body. But the damaged villi are too short to reach the nutrients, and so they pass right over without being absorbed. Types of celiac disease. Classic celiac disease produces the most common symptoms like gas, bloating, and constipation. A thorough symptom list for children and adults can be found in the next slide. Non-classic celiac means the disease does not present itself through normal symptoms and can affect the body extra-intestinally. According to the gluten intolerance school, these symptoms may manifest through migraines, ataxia, neuropathy, and overall neurologically. Someone with silent celiac is a carrier for the disease but does not exhibit any symptoms or effects from the body's presence. This person may only know they carry the disease through genetic testing. Those with silent celiacs typically live normal lives without any complications from celiac. In terms of symptoms, there could be varying reactions depending on the age of the person. A child tends to face more severe reactions to the disease than an adult would. According to celiac.org, a child's symptoms may include, but are not limited to, abdominal bloating and pain, chronic diarrhea, fatigue, ADHD, and many more. Children can face several issues on a developmental level as well. Children with celiac disease can be easily irritable, which can affect the child's behavioral development. Celiac disease can cause delays in the child's growth and puberty, affecting his or her overall development. Adults face fatigue as well, but they are less likely to suffer from digestive issues as children do. Adults tend to face symptoms such as unexplained iron deficiency anemia, bone or joint pain, liver and biliary tract disorders, and several others. Celiac disease is genetic, and because it is genetic, that means that there is no way to avoid contracting celiac disease due to the fact that it is already coded in your DNA. It is for the same reason that no one can be immune from celiac disease, other than not having the gene that codes for celiac disease. Due to the genetic nature of celiac disease, if you have an immediate relative that suffers from the disease, your risk for having the disease increases by 10%. Looking at the larger picture, 1 in 133 people in the United States are affected by this disease, compared to 1 in 100 people worldwide, with an increased risk in the countries of Turkey, Iran, and Egypt. Due to the fact that celiac disease is genetic and not infectious, it has a more personal relevance as opposed to a global or national level. The personal relevance has to deal with the fact that the entire diet of the affected individual has to change for the rest of their life. The change in diet also causes a problem for the affected person and family by increasing the cost of food that will satisfy the gluten-free diet. Also, the associated doctor's visits and tests that relate to getting tested and diagnosed with the disease increase the monetary costs for the affected individual. Celiac disease also becomes relevant to the affected individual's families because they also should get tested for celiac disease due to the increased risk. The economic impact of celiac disease would be the increase in gluten-free products that would be produced as the demand increases as more people get diagnosed with celiac disease.